one is type 3. Now type 3 is very similar to type 2. It's the IgG, IgM, but what it is, instead of being on the outside of the cell, this is now inside someone's blood vessels. Okay? It's in the arteries, it's in the veins, it's in the venules, and so what happens here is it goes into the veins, and then it will basically clog up the veins. So this will give someone glomerulonephritis. It clogs up the veins. It gives someone arteritis, inflammation of the arteries. And so you'll see people who have nephritis, and they will get deposition in their arterial system. So it's same stuff, but different location. Okay? Same prep, different day, basically. Okay? Does that make sense? So that's the difference between 2 and 3. Type 2 takes about 1 day to happen. Type 3 can take a day or 2 to happen, 2 to 3. And type 4 is basically it's T cells. Type 4 is the T cells. Remember, that's like the white blood cells. It's not the immunoglobulins, it's the white blood cells. And it's delayed. There's no antibodies involved here. Okay, so when you see problems with that, it's like someone has a TB test, give them a skin test, and all of a sudden, your WBCs come there. I don't like this. And so you can get granulomas, contact dermatitis, sarcoidosis is the mechanism of this. Again, these are all test questions that people love to test people on. So have examples in your head. Type 1, anaphylaxis, IgE. Okay. Type 2 is basically autoimmune problems that you could have. Rheumatic fever, transplant problems is type 2, hypersensitive. Type 3, it's in the plasma, it's in the blood, so you're going to have vasculitis. So you're going to have rheumatoid arthritis, you're going to get serum sickness. This is, when someone does a transfusion, where does the transfusion go? In the blood vessels, right? Guess where, and which one has serum sickness? The one that's in the blood vessels, type 3. There you go. You know that question for the rest of your life. Or the answer. Does that make sense? Thoughts? Am I confusing you all? I just want to make it clear. And really what you'll see is people have type 1 is what you really are going to see a lot of. But you can see type 3 when people have serum sickness, they get a transfusion. You're taking someone from one place to another, you have blood hanging, and all of a sudden they get really, really sick. Don't say, oh my God, it must be an allergic reaction. No, it's hypersensitivity type 3. Okay, it's different, it's in the plasma. Okay? Yeah? Sure. So that would be about your cell, the antibodies on the cell, and that would be type 2. Transplant reaction. Good question. Because you've got someone else's, they try to match you as well as you can when you get a kidney, but nothing's perfect. So that's why you take the immunosuppressive medications. Okay? Good? Bad? Ugly? Nothing? Alright, everybody has heat stroke. I know, I did too. Okay. Yeah. We went through the primary versus secondary. Primaries when you've first been exposed, secondaries when you've seen it again. It's like fool me once, shame on me. Fool me twice. Fool me twice, shame on me. Fool me once, shame on you. Twice, it's my problem. Twice, you're gonna have very strong reactions. It's like someone says, look down here, and you go like this to them. The second time they say, look down here, you're gonna kick them because you know what's coming. Again, our external defenses do it. That's why you wear PPE. It's an external defense for your skin. It helps. A mask so things don't go in your lungs. And the primary thing to help your immune system is to prevent it. There's all this talk that if we got prevented, we got exposed to a whole range of things, our bodies would be stronger. Well, it would be stronger if we could fight it off. You can only fight off so much at a time, little by little. So there are certain conditions that cause our immune system that's not working. One is HIV, and there's also a whole range of immune deficiencies that can have. Kids can be born with. Sometimes a lot of people who are on chronic steroids, you see people on steroids for a month, 2 months, your immune system doesn't work so well. Because what does a steroid do? Have an idea what a steroid does? It suppresses, but how does it suppress your immune system? It's a nice word. It suppresses. There. Calm down, immune system. Don't be upset. Why does it suppress it? What does it do? It stabilizes the mast cells. If you stabilize the bombs, and you stabilize all that stuff, it's not going to explode. And that's what they basically do. They stabilize. They make it harder to trigger them. So that's why when you give someone steroids, it doesn't work immediately. It takes a while to stabilize things. And I'm sure you had infectious disease recently. Last week. So, does this look familiar or not? Please say familiar. Please say familiar.
If not, I'm calling Dr. Kadish.
We'll go through that again. Okay. Okay, so this is good. Okay. But most people don't know that when someone has lymphoma, when someone has cancer, their immune system is suppressed. And the way to think about it, different way to think about it, when people get our immune system is constantly scanning our body for, are you my friend? Are you part of me? Or you're a foe? If you're a foe, I'm going to destroy you. If you're a friend, I'm going to have you stay. Well, how does our immune system tell the difference? If it's really widely different from what we look like, in terms of our cells and what the antigens are in our cells, it will kill it really quickly. What if it's just a little bit different? Instead of everyone wearing blue hats, this one has a red hat. Maybe they don't notice it. Maybe they don't notice it because everyone's 5 feet tall and this one's 5 feet and a half tall. Okay, so our immune system is constantly looking for invaders, and some slip by. When they slip by, and they start to differentiate. That's where they think sometimes cancer can come from, because our body doesn't recognize cells that shouldn't be there, and then they start to multiply. That's one theory about this many. And so, cancer, folks who have cancer are immune suppressed. So immune system's not working as well. It's occupied doing other things. That makes sense? And you can have leukemia, which basically stops you from having different. Leukemia is basically your bone marrow makes blood cells. And some lines of your blood cells aren't made. Every line of your blood cells are important, right? You need the white blood cells, you need the lymphocytes, you need the eosinophils, you need the neutrophils, all of them. So if one line's suppressed, who's going to do that job? Who's going to take into the immune system? It doesn't work so well. So there's certain diseases that you see when someone doesn't have enough eosinophils that you'll see with a lot more parasites. Because eosinophils specialize. Their specialty is killing parasites. So they all have their own specialty. We all have our own specialty. What type of sports we like, or what type of medicine we like, or what type of engineering we like. We all have our own specialties. Or I like being in central lines, you like reducing chores. Everyone has their own specialty.
Or immunocrites, right?
Immunocrites. Yeah. Ooh. So, autoimmune disease, the way to think of autoimmune disease is basically when our immune system is too vigorous. You can have too much of a good thing, and basically starts attacking parts of the body it doesn't recognize. Okay? So, autoimmune is rheumatoid arthritis. Immune system says, I don't recognize that line as me, and I'm going to put a lot of white blood cells there. Complement there. And I'm going to have constant irritation. Constant irritation. So these are all autoimmune diseases. So a lot of people, it's interesting when you see folks who have, let's say, asthma, who have arthritis, and they're on steroids, and they have an allergic reaction, or they tap something. Boy, I usually have an allergic reaction to it, but I didn't until 2 days later. It's because they were on steroids, so it stopped them from having the allergic reaction, is stabilizing their bowels. And then all of a sudden they got too much of it, and that's why they had it, okay? So they're already on steroids. Excellent, that's good. Because they can get away with the small doses of stuff. You ever see people like that? Who, they should be sicker with what they took, but they're not because they're on steroids. Because steroids has suppressed their immune system from overreacting. Not, you will. Transplants. Again, what type of sensitivity is transplants? 2. Here we go. Good. Here's hypersensitivity disorders. This is an easier explanation if you know it's on the cell versus in the blood vessel. So now, this is the fun stuff. What's the difference between an allergic reaction and anaphylaxis? Should we make a list? Let's make a list of all the different things. How do you tell someone's having an allergic reaction versus anaphylaxis? Yeah. Okay. How about I have my what 2 systems would you think would be
Respiratory, cardiac.
okay, respiratory and cardiac. Okay. Because when you exactly right. But when you get a rash, okay? You can have a rash on the entire body, or you can have it localized. Which one is anaphylaxis? Which one?
Entire body?
Typically entire body. Because anaphylaxis is basically your whole body is involved with it. And allergies is just localized. That's how I think of it. Okay? So you can have a rash, and what that is your body's able to say, okay, I can localize it to this area, I can calm down the immune system enough. How fast does someone get anaphylaxis? Do they get it in the first 5 seconds? Do they get it in the first day? Do they get it in the first hour? You go to see someone, they have a 12-year-old who has a rash from head to toe, and they've had it for 3 days. What are you going to think about that? Versus you walk in and someone said, that kid ate a strawberry. This other kid ate a strawberry, 10 minutes later, they're in a rash from head to toe. Which one are you going to be more upset about? Concerned about, right? Concerned. Right. Both had strawberries. What about the time frame? Faster. Right. Most anaphylactic reactions will happen within the first hour. The first hour that they've been exposed to it. So if it's been going on for 3 to 4 days, very low chance of it being anaphylaxis. I didn't say it's not going to happen, but very low compared to someone eats something, feasting, and all of a sudden everything happens. Okay, does that make sense? So we have localized reaction, right? Anaphylaxis, 2 more systems. What are the primary systems of IgE? Where does it live? Like, where does life live? The GI, right? So they poop tremendous. They have tremendous gut pain because of pyrus patches. Their lungs, what happens in their lungs? They got mucous membranes and they get bronchoconstriction. Okay, what about, this is the big one. What happens to the vascular? It dilates. How much does it dilate? How much does your vascular bed gets expanded to? 35% more. That's crazy. If my vascular system gets expanded 35% more in a minute or 2, what's going to happen to my blood pressure? Boom. Hopefully what's going to happen to my heart rate? We'd like it to go work better, but guess what happens with anaphylaxis? Some of the stuff affects your myocardium, and your heart does not work as well as it should. Your contractility goes down. Okay? So if someone has a rash that's localized but has wheezes, what are you going to do? Are they going to more towards anaphylaxis or more toward local allergy? Which one? Okay, let's have a vote. You can't just sit here. Who says anaphylaxis? Who says allergies? Or anaphylaxis? What's the mechanism in the lungs? They're going to have fluid. Okay? Fluid's going to cause them to have edema in their lungs. It's also going to have bronchoconstriction. So that's more systemic. So if I have someone who has a small little rash and now has wheezes, and I'm thinking them towards anaphylaxis. I'm gonna treat. A small rash, voice difference. The voice is different because they have edema in the larynx. I can't tell you how many times I've done people who come in. I don't have anything. I had a little rash. My voice is different. I'm like, oh my God, what am I worried about their voice? They're gonna lose their airway. I don't like that. You don't like that either. It's a horrible thing. So, yeah, it's quick. You can go quick and avoid the crike, or you can go slow and get a procedure. I mean,
Just depends on who's working that day.
depends on who's working and what your thought process is. Haven't done one, need to do one. Yeah. So, does that make sense? The difference between anaphylaxis and allergies. Okay. Listen aside. What's gonna make your allergies worse? What was gonna make someone worse or anaphylaxis? What's gonna make this even worse? Repeated exposure. But what can a person do? This is what I love. What do people do to make this happen more often? They start to have allergies, right? And then they say, well, I'm gonna poke the bear, or whatever you wanna call it. People who, oh my God. What makes your immune system unhappy? Not stabilized. So, if someone has, it's just church on drink alcohol. What does alcohol do to your immune system? Does it stabilize it? No. Nope. How about heat? I'm gonna go sit in a hot tub and I have a rash. What happens to that rash? It blossoms. What happens to your shortness of breath and you have asthma and now you go sit in a hot tub? Does it make it better? No. It upsets your immune system, doesn't like it. It's too hot. Okay. Smoking. Man, I can't tell you how many people I see smoke who then have something happen. What does the smoke do? What's in smoking? What's in tobacco? How many carcinogens, different compounds are in there that can get your immune system all excited? So you already have it excited and you're gonna throw some gas, sort of notch up. Okay? That makes sense? Okay? If you disagree or have comments, please that's what I'm here for. Have a discussion. So these are the things that you think of for anaphylaxis versus allergies. Okay? Anaphylaxis is quick, less than an hour. People will die from anaphylaxis. If it starts to go and people start to have hypotension and wheezing, what's the death percentage? It's a higher level. It's really freaking high. Really, really high. How much do people usually get by with just one shot?
It depends on how frequent they have the reaction, how bad it is.
Yeah, but most people usually end up with two. Or an epitrip. There's choices, but they go into shock. They go into hypovolemic shock, and they also go into cardiogenic shock. Isn't that, they get two. Some people say they go into neurogenic shock, 3 ways. So, but these are all the things. So someone said, I had fish, and I'm not supposed to have shellfish, but I had it once, and I did okay. I just got a little rash. They do it again. They had the second phase, right? First time not so bad. The second time, my IG, which is M or G, is the one that's going to be remembering. G, I remember that. G, I remember that stuff. It was great. And bam, it's a horrible reaction. But I did okay a few years ago. Not today. Not today. So, we see with medications. Someone gets a new medication. They've never had a medicine. That medicine's flavor-free, and they get it and they get an allergic reaction. Always err on the side that it's probably an allergic reaction versus an allergy.
Like what happened today in my hospital time. She had gotten morphine for the first time. And then like immediately you could see all like a little rash start to form, and she was like, I can't breathe, and her stomach hurt. But she was
Yeah, so that was, she had histamine release. That's a classic one. That was histamine gets released.
so you could see it like immediately.
Yes, but the stomach has to do with the immune system being in the stomach. And people say, why is my stomach bother me every time I eat something. I'm like, because you're having an allergic reaction to the food, perhaps you should stop.
Before it becomes anaphylactic.
Before it becomes anaphylactic. So here's the causes that we talked about. Bronchospasm. So people have, it sounds like asthma, but it's not. It sounds like CHF, but it's not. Here's all those things that you don't have to know, and I forgot. All these things. You just have to know histamine. Look at this. Decrease, a big one. Decrease coronary blood flow. That's why the heart doesn't work so well with anaphylaxis. Okay? It's not just your lungs, it's your heart. And they didn't know that for many, many, many years. Dysrhythmia. You can see anaphylaxis. So it's really a horrible thing to see. One of the worst anaphylaxis cases I saw was the woman came in, she was in shock. But there was no rash, no past history, nothing. She was just pale, cool, sweaty, looked like crap. And she didn't have a fever or anything. So they just had pulled her off the street. I'm like, well, I'm just going through all my algorithms in my head. And I'm like, well, the only thing I can give her is an epi, and let's see if I gave her fluids, and I gave her an epi, and all of a sudden, everything got reversed. What does epi do? This is the best thing. What does epi do? Okay, let's work our way down. What does it do for vasodilatation? What does it do? The vasoconstricts lost that 35% extra in our vasculature goes away. As it goes away, what happens? Our pressure goes up because you have vasoconstriction. That is life-changing, life-living. Okay. What does it do for your bronchioles? Relaxes the smooth muscle. That's a win. Okay. What does it do for your heart? Helps the contractility. Okay. All those are wins. Does Benadryl do that? No. So when people think they're going to treat anaphylaxis with Benadryl, no, it doesn't work. I can't just give you a Benadryl and walk away. I can't just let you take Benadryl and walk away. It doesn't work. So that's the main, most important thing that epi does. Again, heart contractility, vasoconstricts, and smooth muscle. Smooth muscle lungs relax and breathe. Okay, that's what you need to do. That's how you're going to get them out of distributive vascular shock. Okay, and the other thing you're going to do to fill up that vasculature that has now dilated is give them tons of fluids. Not 300 cc's, but a lot of fluids. A third of your volume has now just increased. You need something to fill them. Does that make sense? Questions? Here's all the agents. Just think of anything that is in the world. I mean, it doesn't matter. Most people don't know what it is until later. They try to figure it out, but they have no clue. Sometimes it's a combination of 1 or 2 countries. So I got my immune system, got a hit over here, and then I saw this. People try different things. I mean, preservatives. Anytime you have food that's prepared food and they added something else, another spice, another preservative, you have no idea. Most of the stuff that the body hasn't seen. So, what do you do when you see someone who's sick? This is your bread and butter, right? It can be 30, 60 seconds. It can also be 30 minutes later, 40 minutes later. Swollen lips, tongue. Get the history. Physical exam. What do you want to know about physical exam? What do you want to know? I'm looking at the person. What do I want to know? How are you going to know they haven't been? Stridor. Okay. What's the sign of someone being short of breath besides stridor? Accessory muscle use, nasal flare. Exactly right. Respiratory rate. Maybe a little whoosh. Rashes. You're going to see rashes. When people get warm, or hot, the rash will come out more typically. Physical exam. Do they have any facial edema? Eyeballs, eyelids are huge, right? This whole area, huge, swollen. Lips, tongue. Ever seen people's tongues swelling? Who's seen people's tongues swelling? It's a scary thing. I mean, it's not just a little bit, it's big. But before it gets big, it has to grow. So what do people say when the tongue is growing? Getting big, what do they tell you? My tongue, it doesn't work right. It doesn't work right. I mean, they can't, it's fact. Their speech is different. Have you seen people with that at all? Yeah, it's like, it's different. And so you always have to, before you get really big and fat, you had to get somewhere along the line, things changed. Okay? Your bowel sounds are going to be hyperactive. Why? Because you have GE there. Decreased level of consciousness. Why is that? Why do you have decreased LOC? Lack of blood flow, hypotension. There you go. Hypoxia, because your lungs aren't working. All those things. So people aren't answering questions correctly, not because they don't want to, but because they're not functioning. And so it takes a little while. The patient I had was just kind of on the gurney, just moving and moaning, and there was nothing on her, no rash, nothing. So it's just like, what? That's the only thing I can think of. What would give you a shock? Let's look at the different types of shock and how to correct them. Here's urticaria. So if someone has this and they go running, they drink alcohol, they put rubbing alcohol on that, they put witch hazel on there, it's going to get worse because it's an irritant and it's going to have more histamine release. Heat will make histamine release more, mast cells degranulate. And here's the shock. It's pretty bad. It's 65% fatality for someone having it. 65%. Because most people don't get to see you guys. They're fishing, they're birding, they're whatever, and they get hit or something. They have their EpiPen, maybe with them, maybe in the car, but it's just a one dose thing. They don't have a second dose. So, if I come onto a scene and someone has been hiking, and someone has anaphylaxis, what do I want to look at? They said I got stung by a bee. What do I want to know?
Where are the bees?
Where are the bees? Yes. Is it an in-ground nest? Lovely. I get stung. I don't like being stung. I get sick. So where are the bees? Where is the snake? Here's all the other things. And, you know, some bees sting multiple times. Some bees get to sting one flavor. I don't need someone to identify which bee it is for me. I don't care. It would be nice, but, you know, if they have the stinger still in, you just basically take a card and then you go the opposite way and get the stinger. Okay? Airway is one of the most important things because A is for airway. B is for breathing. Adjuncts. Intubate early because if you get swelling, you're going to get to do a needle-prite. We want to avoid that.
Most people like to.
But really, go to IV. Again, fluids are important. 12 leads. Epi, epi, epi. What does antihistamines do? What was that? What, come on. Out loud. I don't care, right, wrong. So they calm down the histamine. Isn't that nice? So you can, but they don't work immediately. Okay. With anaphylaxis, the cow is out of the barn. The horse is out of the stable. Whatever you want to call it. It's already having the reaction. The antihistamines help who's ever in the barn stay in the barn. Don't go out. Okay. But you need to do the steroids again. Help with the secondary response. Vasopressors will increase your blood pressure. Beta agonists, Proventil, support. What psychological support can you do for someone? What do people say when they've had an anaphylaxis? Let's talk to you about it.
The scariest thing they've ever had.
Yeah, it is the scariest thing they've ever had, and they feel like they are going to die. And they will tell you that. I feel like I'm going to die. nothing gets my hair, the back of my neck, my attention more than that. Because most people don't say that. Most people do not say that. They really feel like they're gonna die because their blood pressure's plummeting. Their heart's not working, not getting oxygen, all of that stuff. So here's about epi. Okay. So they have contraindications, underlying cardiovascular disease and high blood pressure. Well, it's really hard. No, I'm sorry. I can't give you epi because you had cabbage 5 years ago. So I'm going to watch you die because it's very difficult not to do so. You have to have it's basically and high blood pressure. Right? If you could not give epi to people with high blood pressure,
You'd be able to give it to anybody.
yeah, you'd be able to give it to. So those are the contraindications, but they're really not the contraindications. That's what they say for tests and all, but it's really not. And the doses, it depends on how big the person is, but no, it's an IM injection, not an IV injection.
They can give it IV up to
1,000, right.
Right, but not the one.
Yeah. Once had someone who was in nursing school, I asked her which dilution of epi would you give, and IV. And she looked at me and thought about it, and she said, clearly, for 1 to 1,000. And I said, okay, explain to me why. And she says, well, it's going to go into your blood, and it's going to get more diluted. By the time it's going to get diluted, it'll be at the right concentration. And I said, that is a very thoughtful answer, but so wrong, you will kill somebody. So, again, 1 to 1,000. And you give the dose. And before you give epi, since you know the people are already having anxiety, they're already having palpitations, you can say you're going to feel more anxious. But I guarantee by the time you're done, you're not going to have that feeling of impending doom. You're going to feel like you have 5 cappuccinos or lattes or double espressos because your heart does pound. So when you're treating someone with anaphylaxis, you can give them Benadryl, and it blocks H1. It helps, but again, it's not the answer. Okay? And how Benadryl and steroids help, there's 2 things that happen when someone has an allergic reaction. The first one is the big boom, everything gets degranulated, right? You have that. And then you have a secondary delayed response, which can happen a few hours later to up to 72 hours later. And that's because your body is still making histamines and it's still going to release histamines and mast cells. So you need something to keep them in the foreign and stable to quiet them down. And that's what the Benadryl does, and that's what the steroids do. Okay? So everyone who has an anaphylaxis reaction or even a bad allergy, they need to be on meds for at least 72 hours. So it doesn't, secondary reaction when it happens, do something to keep it down. Does that make sense? Questions? So you always give the Benadryl not because it's the cure, but it's going to stop the secondary reaction and help decrease these problems. Sometimes, and Benadryl, someone's just having a rash, you can't help it. And steroids, inhibits the inflammatory process. It helps tremendously. We give it quickly, but it doesn't work quickly. You think it does. It does. But you know, in 5 years they'll say it does. This is one of the things they keep arguing back and forth in medical literature. Magnesium, steroids, how fast steroids do we need to give? And the reason why it makes you have high blood pressure, it gives you a lot more fluid. GI bleed because it's corrosive to the mucosa, decreases how much the GI mucosa will propagate, sorry. There's the different doses. So, again, this is what we've talked about. Mild allergic versus anaphylaxis. Is this important? Yes. Take a picture, put it in your brain. really, really important. This mental status I can't stress enough. Oh, look, I have a rash, I've had it for a week. Can I have an epi, please? Versus, I am really, really anxious. And severe, I can't, the GI system, severe cramping and severe poops, diarrhea, shits, whatever you want to call it. I mean, it's a mess. So, these are the differences. And you can really tell someone. I think you're having an allergic reaction because of this, and this. But let's make sure that it doesn't become anaphylaxis. Let's take Benadryl for a few days. Let's not drink alcohol. Let's stay in the hot tub. Let's not run. Let's not swim. I know. Risk the worst. So, how do we manage this? Again, first, where's the toxin? Where are the bees? Protect the airway. A, B, C. All the things. Ice for swelling helps. It's comforting. Decreases the release. If someone, it hurts, they feel like they're going to die and the hand's swollen, you decrease the swelling. It helps a lot. I'm not saying tourniquet. And organ transplants. What type? Hypersensitivity organ transplants? 2. All right. Our work is done. This is good. And atropine, does not work with a heart transplant, right? This vagal nerve has been cut. Your atropine will not work. And these are for any transplant infection. Any other thing? Rejection is basically coughing, shortness of breath, growls. So, same thing. Can you give, does Proventil help if someone's having anaphylaxis? Proventil? What is Proventil? Look it up. Albuterol? Can albuterol help? Because why? So help open up the lungs. You're looking for anything. Give that to them while you're getting the epi. Ready for a case?
I'm ready for a case.
Alright. 16-year-old male complained of, I can't breathe. What do you think you want to dispatch? What do you bring with you?
Everything.
Everything. I like that, everything. Tripod. Boy, that doesn't sound good. What are your first steps? Needlecraig, right? Who's in favor of needlecraig? Yay! Woo! Okay. Good. Fill that procedure log. Airway. Swollen tongue. 3 words. A sentence. Accessory muscle use. SpO 290. Oh, my thinking is, I need to take a break. Somebody's covered this. I can't do this one. Circulation, pal, flu, and clammy. No bleeding. What are you thinking?
Epi.
Epi. What else is in differential?
Oxygen.
Oxygen. Okay. What else could cause this? Asthma. Okay, what else could cause this? Let's say the person had a strep throat before. Tonsils huge. But they got better. What can cause illness? Epiglottitis could do this, except we wouldn't have a swollen tongue. Let's say someone went to a dentist. Went to a dentist, had a dental procedure. Didn't take their antibiotics. Now they have a swollen tongue, their airway's messed up. They have soft tissue swelling, they have an infection in their airway. This is the exact same thing you would see. It's not anaphylaxis. It's a little weak as a we'll turn that. Initial vital signs, 140. Wheezes. Blood pressure is better than I thought it would be, 90/50. That's pretty good. Heart rate 140, 190. Hives. Amp rating. Oh, well, look, the person had breakfast. And they had the doctor's visit. And the prescription. Got everything. And they have allergies to cat. What else? What do you do? You give up the oxygen. Don't they look like they're getting better? Now the blood pressure is 70/40, and we're doing good. Let's go to 85. Don't break. Anxious, still has contractions. Now what? Fluids. Neb treatment. Right? Nebs. What do you want to give him? What neb do you want to give him?
Duoneb.
Duoneb. Does bagging the person help? If they can tolerate it. But if they can't tolerate, then you are smothering the person. That's never a good thing. You can repeat the epi, right? Benadryl and Decadron. We're going full court, but you gotta remember to give people fluids. Have to remember an anaphylaxis fluid. Yeah.
Maybe a stupid question, maybe not. Would you give the Duoneb or just the albuterol?
Yes.
I just asked because I thought we said generally regular steroids don't work for.
They don't work immediately, right?
infection.
But doing the Duroneb is absolutely fine. I don't care which. Giving Proventil, albuterol, for sure. If you're going to give the amitriptyline with them, that's fine as well. That helps. It's not a name. Duroneb, not steroids. Duroneb doesn't have the steroids. There's other nebs that have steroids. This one doesn't. Duronebs don't have steroids. It's dry secretions. It's anticholinergic. Drug. Yeah. It's an anticholinergic. It's not a stupid question. I'm sure it's a lot of people have the same problems. Any other questions? Brilliant or not questions? Alright. Person is doing better. So they're doing better. Do you think we can let them go?
No.
How come?
It's gonna come back.
It's gonna come back. There's a delayed reaction a few hours later to 72 hours later. So they need to stay. And the ER will keep them at least 6 hours. Questions, thoughts, comments, criticisms? Anything? Okay, so remember, the difference is 4 types of hypersensitivity reactions. Those are all important things.